In the United States, pregnant citizens are eligible for a broad range of benefits, resources, and legal protections designed to support healthy pregnancies, secure medical care, protect their jobs, and help families maintain financial stability. One of the most fundamental forms of support is health insurance coverage. As all marketplace health plans and Medicaid plans are required to cover maternity care and newborn care as part of the essential health benefits under the Affordable Care Act, meaning that prenatal visits, labor and delivery, and postpartum care must be included in qualified plans without denying coverage simply because of pregnancy. And these requirements apply even if the pregnancy begins before coverage starts. Ensuring those enrolled in health insurance can access necessary medical services without discriminatory exclusions. Pregnant women with low income or no insurance can access Medicaid and the Children's Health Insurance Program CHIP, which are the largest public payers of pregnancy-related services in the U.S. Federal law requires states to provide Medicaid coverage to pregnant women with incomes up to at least 138% of the federal poverty level (FPL), and many states offer higher thresholds up to around 185% or more, covering the full spectrum of prenatal care, labor and delivery services, and at least 60 days postpartum care with an option for extended postpartum coverage up to 12 months. An important safeguard that ensures medical costs don't become prohibitive for low-income expectant mothers. Beyond basic medical coverage, there are specific nutritional support programs, such as the Special Supplemental Nutrition Program for Women, Infants and Children (WIC), a federal food and nutrition service program that provides vouchers or electronic benefits for nutritious foods including milk, whole grains, eggs, fruits and vegetables, nutrition education, breastfeeding support, and referrals to health services for pregnant women, postpartum women, and young children up to age 5. Eligibility typically requires income at or below 185% of the FPL, but participation in other benefit programs like SNAP or Medicaid often automatically satisfies WIC's income requirement. And extensive research shows WIC participation contributes to healthier pregnancies, lower infant mortality, and better nutritional outcomes for both mother and child. For families facing food insecurity more broadly, the Supplemental Nutrition Assistance Program, SNAP, formerly food stamps, can provide monthly electronic benefit transfer (EBT) funds to help buy groceries. And pregnant women can apply for both SNAP and WIC to maximize nutrition and food support during pregnancy. Beyond food assistance, pregnant citizens may be able to access Temporary Assistance for Needy Families (TANF), a federal block grant administered by states that can provide cash assistance to needy families, including pregnant women, to help cover basic needs such as rent, utilities, clothing, and medical supplies. Although eligibility rules, benefit amounts, and work requirements vary by state. In addition to direct health and nutrition programs, pregnant Americans can seek help with housing and utility costs. Through federal programs such as the Department of Housing and Urban Development (HUD), Housing Choice Voucher Program Section 8, or other low-income housing assistance, and LIHEAP Low-Income Home Energy Assistance Program, which can assist with home energy bills. Though these supports are not pregnancy-specific, but often vital to family stability. For families with children, tax credits such as the Child Tax Credit can provide significant financial relief by reducing tax liability and for eligible families, resulting in refundable payments that help offset children costs. While these credits apply after birth, planning ahead during pregnancy allows families to prepare to claim these benefits after the child is born. Pregnant citizens can also benefit from legal protections and workplace rights. The Pregnancy Discrimination Act (PDA), a federal law that amended Title VII of the Civil Rights Act of 1964, prohibits discrimination on the basis of pregnancy, childbirth, or related medical conditions, ensuring that pregnant workers are treated as well as other employees, similar in their ability to work, and it applies to employers with 15 or more employees, covering hiring, firing, promotions, pay, and job benefits. Complementing the PDA, the Pregnant Workers Fairness Act (PWFA), effective since June 2023, requires covered employers to provide reasonable accommodations for known limitations related to pregnancy, childbirth, or related medical conditions, such as adjustments to job duties or schedules unless doing so would cause undue hardship. Expanding workplace protections for expectant employees beyond basic non-discrimination principles in terms of job-protected leave. The Federal Family and Medical Leave Act (FMLA) allows eligible workers employed by employers with 50 or more employees to take up to 12 weeks of unpaid job-protected leave in a 12-month period for serious health conditions, including pregnancy and childbirth, with continued health insurance coverage during the leave period, although many workers do not qualify for FMLA due to hours worked or employer size. In states with paid family and medical leave programs, eligible workers may receive a portion of their wages during leave, but these programs vary significantly by location and have different eligibility requirements and durations. Such policies remain relatively across states. States of state status New York's law requiring private sector employers a minimum of 20 hours of pregnant miles significant milestone, a significant millisecond in sepicimenity, Bobble as such policies licely clearly susan be support as quickly and barbin sent and so as when we cried and when the card and where and I and all and In addition, federal labor laws like the Fair Labor Standards Act (FLSA) include provisions such as reasonable break time and a private space other than a restroom for expressing breast milk for nursing mothers at work, adding another layer of workplace support that continues into the postpartum period. Pregnant and postpartum individuals also can leverage health savings tools. For example, use of a health savings account (HSA) or a flexible spending account (FSA) allows for pre-tax contributions to pay qualifying medical expenses, including prenatal care, delivery, and postpartum care, effectively reducing out-of-pocket costs associated with pregnancy-related care. In times of unemployment or income disruption, pregnant women may also explore unemployment benefits if they qualify based on prior work and state rules. And in states with programs like short-term disability insurance, they may receive partial wage replacement if unable to work due to medically documented pregnancy complications or recovery after childbirth. Throughout pregnancy, pregnant citizens have access to a range of community and public health programs supported by federal grants and state initiatives that provide prenatal education, home visiting services, case management, and outreach to at-risk families, often aimed at improving maternal and infant health outcomes, connecting women with services, and reducing infant mortality. These programs, supported through mechanisms like the Title V Maternal and Child Health Block grant, help fund community-based care systems for maternal and child health services across states. Taken together, these health coverage options, nutrition and food assistance programs, cash and housing supports, workplace non-discrimination laws, job-protected leave rights, tax benefits, health savings mechanisms, and community services create a comprehensive framework of benefits and protections for pregnant U.S. citizens. Although the availability and generosity of some benefits depend on factors such as income level, employment status, state of residence, and individual circumstances, navigating these programs effectively often involves contacting local social services agencies, state Medicaid offices, employer human resources departments, or advocacy organizations to understand eligibility criteria, application processes, and how best to combine these supports to ensure a healthy pregnancy and a stable transition to parenthood.